Welcome, everybody. This is D. Durrell with D. Durrell Life Solutions. Happy to be here once again on this morning. Something is wrong with my goddamn countdown. I am broadcasting, while I'm driving on my phone, heading to my private practice, and so we're gonna have a conversation. Before we have a conversation, I'm gonna go ahead and do a small little music break so I can give a little music and stuff. I get some things situated. We're going to discuss the autism community. We're going to talk about the pushback that I have received from talking about autism and self-diagnosing autism. So I'm going to go ahead and do a one small break for about a minute, and then we're going to continue. All right, I am back. I have two in the chat. Good morning to Miss Light Smith Teeth. Good morning to you. Happy for you to be here. Go ahead and get the likes up on that. Again, the guys, I want to wish everybody a good morning. This is D Durrell with D Durrell Life Solutions. We are going to have a conversation regarding the autism community, and I'm going to talk about this interaction that I have embarked upon with the autism community over the last 2 weeks. Okay, as you all know, for some of you and those that don't, on my other channel, I had a person that I've been a long time friend with who talked about self-diagnosing herself with autism, and as a mental health professional, I took great offense, not from a person, not personal, but from a professionally. I took offense from people thinking that they can read information and apply that to themselves. without any training. Even if you had training, even if you were educated, you would understand that it is unethical. It's unethical to self-diagnose yourself. Now, as she continued to go around talking about this, I noticed that people in the community, particularly those who had a friend, a family member, child who had autism, they came out the woodwork, and some of them were co-signing what she was saying. Yes, that is crazy, Lisa. And so they co-signed what she was saying. And they used Google as the primary reference, which I thought was laughable. They didn't seek a professional. They didn't seek anybody, a bona fide provider, site from a professional like myself. There are people that think Google tells the whole story on everything. Google is this almighty reservoir of information that will give you an answer to everything. And unfortunately, you're false. It's not the case. So, right, I want you all to understand, when I did the video, letting people know, self-diagnosis is not a real diagnosis. Self-diagnosis is not an unofficial diagnosis. Self-diagnosis is not recognized. It's not a professional diagnosis. It's not an official diagnosis. It's a fact. If people could effectively diagnose themselves, what the hell we need a psychiatrist or a psychologist for, or a therapist? If you think that you can effectively assess someone, that means you think you can effectively treat. And I'm going to talk about the autism community that I know. Excuse me. Excuse me. The autism community that I know in a normal society, they do not carry on in this manner. They don't. They don't carry on in this manner. They don't go about thinking because they took continuing education courses and training, and they took certifications that were only limited to the damn training. They're not going around acting like they are an autism spectrum expert, specialist. Part of the training consists of the fact that you have to have a bachelor's degree or a master's degree and getting certified. But nobody's talking about being a board certified behavioral analyst, a BCBA. Nobody's talking about the fact that the people who have a BCBA they have master's degrees. Some of them. These are certified. And they have the educational training, and also you got to go through thousands of hours of clinical training to hone your skills. You're seeing a multitude of kids and adults of all ages and all levels of the autism spectrum who present the illness in a variety of different ways. Also, we must be aware that these kids with autism are heavily influenced by the resources that they have in their community and their parents. Because there are parents who are more involved than others. There are parents who will go above and beyond for all resources and all training. And then you have parents that don't do it so much. Then you got parents that are neglectful of their autistic children. I'm speaking to the autism community as you all come in. And if you are in the chat, in the clouds, and you are part of the autism community, please let me know. I would like to have a conversation with you. Because the treatment that I have received from the autism community in the Black YouTube space was mind-boggling. And it was unexpected. And I was somewhat conflicted. Because the way I was treated and criticized was not indicative of how I am treated as a mental health professional in my practice and my businesses. And those are facts. Now, Ms. Lice just stated, my son wasn't diagnosed till he was 9 years old. And I'm glad that, they were able to identify it until he got older. The earlier detection, the better. Now, one reason why I did not go as hard as I wanted to go against and say things about autism is because I don't treat autism that often. It is not individuals, because you guys gotta understand, these are individuals first, persons first, people first. My clientele doesn't usually consistently involve individuals with autism. My practice usually consists of those who have other forms of mental illness, mental health conditions, behavioral issues, emotional related issues. I deal a lot with people who have mood issues like depression, they have anxiety, they have psychosis, stress related issues, PTSD, schizophrenia, personality disorders. That's what I primarily deal with. There was a period, I'm going to talk about the autism community that think I don't know what I'm talking about. I treated, provided services for my first autism client, probably, and this was at the paraprofessional level, about a year in my master's degree program. I worked for a company that provided direct care services and observational services, case management services for children with behavioral and issues and intellectual deficits. And I had a kid, and this is when I was living in Baton Rouge. I had I think he was probably around maybe 9 or 10 years old. Had like a 9 or 10 year old kid, African American male, who had autism. And I'm going to tell you all, in all of my 23 years of being in this field, providing services with autistic children was the most difficult, but it also was very gratifying at the end of the day. And once the kids achieved milestones, I did observational things with him, did activities that coincide with behavioral therapy. He was nonverbal. Matter of fact, I'm going to say this. After I provided services for him for about maybe 6 months, and then I had another kid. I had a racist white kid that had autism. He was probably like 16, 17 years old. And that didn't last long. After 2 visits, I couldn't take it anymore. He was verbally aggressive. Um, and he was a bit violent. And he treated his mother harshly. And I let him. I had to stop with him because of the racial stuff that he was saying, and also the mom was enabling, and she was afraid of her own son, and so they needed more services or someone more equipped. Now, about I want to say I went without treating autistic. I think I worked at another facility when I moved to Houston in 2003. Maybe a couple years later, I was working at a residential center. So before I continue, shout out to Golden Black One. What's going on, cutie? How you doing? I see Kai NY007. How you doing, baby? And Nova Real Show. What's up, brother? Appreciate you for coming in. I'm glad you all are here. Now, upon working at this residential center for adolescents, there were probably 1 or 2 kids who were autistic. I think, if my memory serves me correct. But this was more on me working. Even though I had a master's degree, I was still working at the kind of a paraprofessional observational level, case management level. Now, fast forward. I worked for a local mental health provider, large mental health provider. There were a couple of a few clients that I had that were diagnosed with autism. At the time, Asperger's was in the DSM. And I had in my 5 years of working there, I was providing services, behavioral services, to about maybe around 3 autistic um, individuals. And they all were males. All of these individuals were males. Matter of fact, most of my um, kids that I treated that were autistic, most of them, I think I had maybe 2 females, and all of them were males. Most of them were males. So that was my experience. Now, I went from treating childhood autism, which was at the severe level, nonverbal, to all of a sudden now treating adults with mild level of autism who were somewhat highly functional, but may have needed some assistance. There is a gross difference in the level of treatment, the therapy itself, how they present themselves, because at those edges, there are different issues that are presented for them. Because the main thing we have to look at, autism is a communication disorder. Communication defines how you will socialize. Your socialization is highly predicated on how others perceive you and how you perceive others. Autistic individuals are not sociable people. They're not, for the most part. When you're looking at autistic children, their awareness is not the same. Their internal, they operate from an internal sense. You're right. A small number of I think it's a little bit. I'm not sure about the particular statistics now, but I think it's a little bit more. The reason why I think it's a little bit more now because there's more research and there's better assessment of autism. So therefore, when you have more research and uh, better assessments, applications, it's going to identify things quicker. It's going to identify the behaviors. I'm going to say earlier, and more people are seeking services now than in the past, and the fact that there's more education, and so people are more comfortable in discussing these issues. But I want us to understand, and shout out to HBIC or S. I want us to understand that it presents differently. I actually enjoyed working with the adults that were verbal, and some of them could mask the autism. You would not really know that they were autistic just by initially interacting with them. However, if you talk to them long enough and you see them in various social situations or in conflictual situations, you will see the delayed reactions. You will see the repetitive behaviors. You would see a lack of eye contact and a lack of conversational continuity back and forth in regards to their affect in that process, meaning how they feel, their facial expressions. You see a difference, and you would notice some inadequacies that are outside of the normal range of a typical adult. Now, I want to fast forward again because, like I said, in my experience, I have never had consistent treat. I never consistently treated that population. It was always on and off. Now, in 2000, I want to say 16 and 17. I think honestly 2017. I provided services for a home health agency that had a mental health component, and I provided behavioral therapy strictly to autistic children. I don't even know how they found me. Matter of fact, a lot of these, a lot of people don't understand that um, there are not a lot of professionals in this specialty with dealing with autistic children. And at the time, they sought me out as a provider. They talked to me about a contract. I had to fill out a host. Man, I filled out so much goddamn paperwork. It was ridiculous in Over Real Show. The amount of paperwork, man, I filled out countless paperwork before I was even able to see a child or an adult that was diagnosed. In that, I provided services, and I was seeing kids 2, 3, 4 hours at a time. They would get so many hours a week. Like certain kids would get approved for based on their level, 5 hours a week, 8 hours a week, 10 hours a week, and I was busting my ass providing those services to them, doing activities, doing behavioral therapy, learning more about ABA, applied behavioral analysis, because that's one of the best forms of treatment. I start learning the use of an iPad has been stimulating and highly responsive to kids or people who have autism. All of my kids, except for one, I had about 5 kids that I was seeing. Um, None of them were female; they were all males, and all of them except for one, three out of the 4 were nonverbal. And so when I talk about autism, I'm dealing with nonverbal autistic children, not those who are somewhat verbal. I'm talking about, the most severe. They all were nonverbal. I had an Indian kid of Indian descent who was highly aggressive. He scratched me sometimes. He kicked and tried to hit me. I actually enjoyed. I used to see him on like Wednesdays and Saturdays. And on Saturdays, I had more time to see him. And I used to enjoy seeing his parents were doctors. And I began to talk. And let me tell you something. They were highly educated because they're doctors. I used to talk to them about autism. I used to talk to them about things that I thought I knew about autism at the time. And they were telling me about this whole thing about people thinking that the doctors, I'm going to say this, they both, the mom was a doctor, the dad was a doctor. The mom actually decided to no longer practice medicine, to stay home and monitor her son. She made a conscious decision to do that. This is a woman who is making over 150 to $200,000 a year easily. The dad was definitely making well over that. She decided to stay home. And in talking to her, she was no different as far as being stressed, as far as um, wanting to learn more. And she's a medical professional. And in her discussions with me, her concerns and different things were no different than any other person that was dealing with autism as a parent. How you doing? No different. Absolutely not. No, not different in any means. And you know what? In dealing with her, I didn't get pushback. I didn't get a situation where people didn't believe me. I didn't get, you know, conflictual situations or people criticizing me. I didn't get any of that. Give me 1 second, guys. I didn't get pushback at all about anything. And she appreciated the work that I did. All the parents appreciated it. And as I was treating them, it was an education for me too, because I don't typically treat this population. Thank you. So for me, I'm gonna be honest with you. In the time of me treating them, I was debating whether or not I wanted to continue to treat uh, individuals with autism because I was burnt out because of the amount of hours that were required. So Kai said, "Wow, dear, I see how how serious mental health can be not only on the child but those around." Exactly. And so with that alone, I understand how mainly these were mainly parents that I interacted with on YouTube online that were very critical of me because this is your child, this is your loved one. You you, you see this as your son. You actually see this person as and as you should. You love this person. You're gonna have a certain level of biasness and subjectivity, and you should because that's your child. Everybody does that with their children. That's not a bad thing. That's part of being a parent. But in treating a child, you cannot look at an autistic an autistic person, a person with autism, I may say, in the lens of a parent. I can't look at them as a clinician in the in a lens of a friend or a friend of the family. So, I'm looking at them as a person first who is suffering from a condition, a developmental neurological condition that was not their fault. And the fact that there's some fuzzy, you know, information in regards to some of the environmental causes. And some claim the medical causes as it relates to immune getting your shots, kids getting their regular shots and so on, you know, immunization shots. So yes, I look at it from that standpoint. And the people in the online autism community on YouTube attempted to crucify me because I would not accept the fact that they self-diagnosed. And who the hell made you in the community the gatekeepers to autism? And who are you in the online autism community gave you the power to dictate how somebody is diagnosed? What credibility do you have to accept a diagnosis? Because your diagnosis is not accepted by an insurance company, nor is accepted by state agencies that fund programs for autistic children. Let's keep it real. That's right. Like lice, meth, teeth. ABA therapy is hard to get at a certain age as well. There's a lot that goes into autism. It does. It's a lot. And so when I'm hearing these women, these people telling me stuff, I'm like, are you serious? Because my interaction with families is quite positive. Um, they were very appreciative, and a lot of them just straight out needed respite. And see, one of the things that they didn't understand about me is that they didn't even know my experience with autistic children, but they automatically assumed my lack thereof. Just because I'm a mental health professional, you automatically assume things without even asking any goddamn questions. You didn't ask me any questions regarding my experience. No, you just went by, well, you were wrong in saying this and you were wrong in saying that. No, I was not wrong. You didn't want to accept. You want to argue a matter of semantics, and you shouldn't call them this, and autism is not a mental illness. Now, it's this and that. I'm sitting there like, listen, all illnesses and disorders in the DSM are not equal, because certain illnesses are caused by human experience and trauma. Some are caused or medically induced. Some are hereditary and genetic. Some are chemical, neurological. And there are always going to be ongoing research to give us more of a perspective on the illness. And autism is one of those illnesses where the DSM, from the DSM 4 to the TR to the DSM 5, changed the diagnosing um, criteria for autism. They took autism out of the DSM. I mean, they took Asperger's. They took Asperger's disorder out of the DSM, and they put it in the autism spectrum. Asperger's is very similar to autism, and they took it out. so many years, they're going to restructure the DSM and change things and so on. And they may add a few things. I don't know the next time that the DSM is structured. They've done many changes, notable changes of the past. This is something that Umar Johnson even talked about. They took out in the 70s. They took out, excuse me, gender identity disorder. In the late 70s, early 80s, they brought in ADHD. They changed in the 90s or whatever. They changed multiple personality disorder to dissociative identity disorder. They changed the name of things. They had the axes that they took away for the DSM-5. They took it away. Hold on. They took the axes out. They took the GAF scores out. There are changes that happen, and it's going to be a continuum. But I want them to understand autism. You're never, as a parent, going to not look at your child outside of being your child. Because your emotions and feelings are going to be involved. As a clinician, I can't allow that to happen. That's unethical. I have to be professional. And I want to have a conversation. I'm glad I have a person in here, Lice Meth Teeth, who's of the community. I am open to hearing your experience, how you feel about things. And then you're also talking about the resources available. You're talking about the availability of ABA therapy. That's a big deal. That's a big deal. I know for a fact there are not a lot of board certified uh, behavior analysts applied behavior analysts in Texas, in the Houston area. Wow, that's incredible. And there are, I'm gonna say this. I mean, I'm in Houston, but there's a lot of resources that I've seen for that population. But that don't mean it's accessible to everybody. She said, "I just got to drag somebody around YouTube for a little while." Okay. Everywhere I've contacted had it for ages 11 and older and under. Yeah, because that's the those are the important developmental years. And I'm sitting here like, you know, and I want the autism community to understand that when it comes to my um, profession, I take it very serious. When it comes to the education of mental health, I take that to heart. One of the things, if you want to piss me off or get my attention or me to really dig into some stuff, is when I hear people miseducating others on mental health. That is a pet peeve of mine, and I take it serious. You may want to seek a private. You may want to seek a private provider because they should have some. Yeah, they are understaffed. That's true. That is a huge situation. Oh, you in San Antonio? Oh wow. Yeah, I'm actually thinking about doing business in San Antonio as we speak. I'm debating it right now, but because I know there's a lot of needs in San Antonio. There are a lot of needs. I engaged in some foster care services in San Antonio quite a few times. I dealt with a lot of kids that transferred from San Antonio to Houston in the past. Now, I want to talk about now my most recent bouts, my most recent interactions with children who are autistic or adults. All right, I got you, Lice. I am currently dealing with a kid right now. I have I have a 12-year-old adult. I'm sorry, a 12-year-old white male who is on the autism spectrum. He is verbal. He does have, matter of fact, I saw him yesterday. He has a lot of behavioral issues. He also has ADHD. Um, he was very happy to see me yesterday because I was out with COVID. Um, we're working on him, working behavioral wise. We're working on him having a routine to make sure that he does his basic ADLs, working on his hygiene, putting his own clothes on, combing his hair, things like that. We're getting him into a routine. Um, he can get violent and upset at times, particularly if he can't get his way. I have to deal with those things. And he's very responsive to me. It took me a while to build rapport with him, but I have the report. It took me about, I say he became comfortable with me after maybe 2 months. After about 2 months, he became very connected to me and somewhat trying to, he attempted to I would not allow him to be interdependent on me. And he was going into that area. And so I stressed him, being more dependent. I mean, independent per se. And his mom was very supportive. And he came through the foster care system. He was adopted, got a new home. He was happy. And I'm continuing to see him weekly on Mondays. Everything's going pretty good. So my primary interaction with people who have autism is that they also had other diagnoses that I was treating besides autism. I was treating people who are autistic with depression, autistic with anxiety disorders, behavior disorders. So I was treating more than one thing. I was treating more than one illness or diagnosis. And it wasn't easy. Man, this YouTube is acting up this morning. But what I wanted to say was that um, I enjoy working with him, and I've had some other kids who had those illnesses also. Excuse me. And I have to go to the and so I have to, I enjoy doing it, and I'll continue to do it as it happens. Now, is it my primary? No, it's not. It's not. But I've been in the game long enough. I've seen enough autistic clients to know how to treat them, and I'm comfortable with it. And I'm comfortable enough to talk about it more than anything. I have a high level of comfortability with talking about these issues. So that's kind of where I'm at. So I'm gonna be not be on too long. I wanted to just be on just to have this conversation. And yes, Lightsmith Teeth. If I become a provider in the San Antonio area, I may let you know, depending on the services. I know actually, um, and I know Austin is not that far away, but I was definitely looking seriously into Austin, Texas. That's actually serious. I actually have a provider that lives in Austin. So, you know, that's something I am looking at in the future, and we'll see what happens. We will see what is going to happen. So, that's kind of my stance. My thing is let's increase dialogue. I'm not going to be here arguing with people. I've looked at some of the online interaction with people in the autism community. I've seen some positive things and I've seen some negative stuff. Um, I seen how some people were getting in arguments. I saw some people that didn't like interacting with the people online. They felt they tried to operate like a cult. I had one guy, and I'm going to show some videos. And I had one guy who who stated that he was worn out and stressed out dealing interacting with people online. It became too much for him. He had to leave the community alone, and that's a shame. Let's see. Red Pill said, "I want to move to Texas. Which city would you think be better for me? Dallas or Houston? It depends on what you're trying to do. Um, if you like a cooler, a smaller city environment, I mean, Dallas is a pretty big city, but it's more confined. It's not as spread out as Houston is. Um, they have a better transportation system. And it's actually, I'm gonna be honest, Dallas is actually a better looking city and a cleaner city than Houston is. So, um, if those are the things you look now, if you're looking for just being in a bigger city, more things to do, more everything, uh, you know, uh, just all around, Houston probably would be more for you if you like bigger cities. Dallas is actually a bigger city, but not as big as Houston. Um, but um, Dallas has some. To me, Dallas is a more organized city. It's more cleaner, um, and it's a cooler climate, especially in the wintertime. Because we don't get winter, really don't get a real winter here, but you'll get winter in Dallas. So it's up to you. Lightsmith T said, "I don't deal with the folk online. People need mental health, and it ain't autism. Man, they think that they're my issue with them. I'm trying not to be personal, but when you start thinking that you are the professional, you start to think that you're the expert, and you're supposed to be there. Just you're not there to be an expert for you're there to support your children or loved ones and make sure that they get the help they need. That's it. When you're trying to dictate, when you're trying to dictate treatment and what somebody should say and not say, and we accept it in our community. Your community don't mean a damn thing from a professional standpoint. You can accept whatever you want, but legally, professionally, the medical insurance wise, they're not respecting you. What you state. They care less. They care less. So, guys, I'm gonna go ahead and get out of here. I'm at an hour. I think that I have solidified um, the time that I needed to express myself. Appreciate you all for being here because I don't go live on this channel a lot. I don't go live on this channel a lot at all. I'm not going to go live that much until I get over maybe 500 to 1,000, and I may look at doing more online. Because this is an educational. This is an educational channel. This is not like my other channels that are they're more entertaining related. This is strictly about mental health, mental illness, talking about specific things. We have an interaction, and that's it. So, with that being said, guys, y'all have a great day. This is D Durrell with D Durrell Life Solutions.